Hi, my name is Leah and I'm here at Cache Valley Wisdom Teeth. I am going to be going over some post-op instructions with you on how to help care for the person who just had their wisdom teeth out and how to help them recover appropriately. I'm going to be going through these instructions as if they had all 4 of their wisdom teeth out. If they did not have all 4, no worries. Just understand that these instructions might vary a little bit for them. If you have any questions after watching this video, please grab one of our staff members. We're more than happy to address any concerns or clear up any confusion. Just make sure and grab one of us before you go. At this point, you should have received some papers that go over all of these post-op instructions. It's double-sided. If you have not had a chance to read through these papers yet, please pause this video and do so. That way we'll be on the same page and things will make a little bit more sense. All right, let's get started. First and foremost, we want to make sure that the person who had their wisdom teeth taken out is not left alone for the next few hours. It takes a little while for the sedation to fully wear off and get out of their system, so we need to make sure that they have someone with them for the next few hours while they're recovering. Next up is gauze. Once we're done with the procedure, we're going to go ahead and place gauze in their mouth that they're going to bite down and put pressure on. That'll help the bleeding to stop. We're also going to send you home with a goodie bag here that'll have extra gauze in it. It looks just like this. You're going to need to help them change out the gauze every 30 minutes for the next hour and a half to 2 hours. Now again, they're going to be sleepy afterwards, and so we never want to just shove gauze in their mouth. So I'm going to show you how we fold it. You'll just need 1 piece of gauze for each side. That'll put pressure on both the top and the bottom when they bite down. So you'll get 1 piece of gauze like this. You're going to open it up, fold it in half, like so, and then fold it in half again, so it's real long and skinny. And then from one of the ends, you're just gonna roll it up like a sleeping bag. We're gonna make this nice little bundle. Roll it up about halfway until the bundle's about the size of your thumb. Now, to change out the gauze, you're gonna take the old gauze out, just throw it away, and then this bundle is gonna go all the way in their mouth behind their very, very back teeth on the gums where the wisdom teeth were. We always want to make sure that we have a piece of gauze sticking out, so we don't want to trim or cut this. It's just going to be hanging out of their mouth. So they'll have one on this side and one on this side. We always want to make sure that we can see a piece of gauze sticking out. That way, in case they do start to choke or have problems, it's easy just to grab it and pull that out real quickly. So the bundle is going to go all the way in the back behind their very back teeth, have them bite down and put pressure on that. We want to make sure that we're leaving the gauze in their mouth for at least 20 to 30 minutes before we change it out. If we're constantly putting dry gauze in and out, then that clot is not going to have a chance to form and they're going to continue to bleed. So make sure that the gauze is in their mouth, they're biting down, putting pressure on it for at least 30 minutes before we swap it out. They should only need the gauze for about the next hour and a half to 2 hours. And you'll know they're done with the gauze when you pull it out and it's like a light pink, a light orangish color. Once they reach that point, if they're still tired, then they can go ahead and rest. Just remember, no laying down or sleeping while they have gauze in their mouth because it is a choking hazard. Let's talk about foods. What can they eat after having their wisdom teeth out? So today counts as day 1, and on day 1, we want them to make sure that they're having foods that are soft and easy to chew, and they are cold. We want them to stick to mostly colder foods today because that's going to help the bleeding to stop. If they're having foods that are hot, that can agitate those extraction sites and can cause them to bleed for longer. So try to stick to colder foods today if possible. So soft cold foods are puddings, applesauce, yogurt, smoothies, milkshakes, cottage cheese. All those are great options for today. A couple things, if they do have a smoothie or a milkshake, please make sure that they are using a spoon to eat it and not sucking through a straw. We want to make sure that they stay away from straws, smoking, vaping for the next 7 days. Anything that causes that vacuum, that sucking motion with your mouth, that can potentially cause a dry socket, which is where the clot comes out too early, and those can be very painful, so please make sure that we're avoiding those things. Also with smoothies and milkshakes, make sure that they don't have any nuts or little seeds in them. Those tend to get caught back in those extraction sites, especially on the bottom, so stay away from those for the next few days. After today, they can have foods that are still soft and easy to chew, but they can be warm. So soups, noodles, pastas, mac and cheese, scrambled eggs, mashed potatoes. Anything that's soft and easy to chew, easy to swallow is perfect, but it can be warm starting after tomorrow. After 3 days, they can start to resume a normal diet. Just pay attention to how their body feels. They can eat what they're comfortable with. Again, make sure they're staying away from seeds, popcorn, anything with little chunks or pieces that could potentially get caught back in those holes. We want to avoid for about the next 7 days. Next up is medication. Now, it's really important that Dr. Burns has been made aware if the person who had their wisdom teeth out has any allergies or sensitivities to any medications. That way we can adjust the prescriptions that we do as needed. Now, where medications can vary slightly from person to person depending on their health history, Dr. Burns or one of our staff will actually come out and go over the prescribed medications with you and how we want them to be taken. If you have any questions, please let us know. You can also reference the papers that we gave you prior to watching this video. All right, if the person who we saw for wisdom teeth today had wisdom teeth on the bottom, we are gonna need them to start rinsing those holes out starting after 4 or 5 days. Now, we've actually started a new procedure here in our office called PRF, platelet-rich fibrin, and we're able to do that on some patients, and that'll affect the days that we want them to start rinsing. For most patients, it'll be between 4 and 5 days after their procedure. We'll clarify this with you once we're all done and let you know for sure which day we want them to start rinsing. Now, what they're gonna do is in this little goodie bag here, we have this syringe here. And after 4 or 5 days, we need them to start rinsing those holes out on the bottom where the wisdom teeth were. What they'll do is just mix up some warm salt water in a cup or a bowl. They're gonna take that syringe and fill it up with that warm salt water, and they're just gonna stick the end of that syringe in the holes where the wisdom teeth were. They'll have to stick their finger in their mouth and pull their cheek to the side. That's gonna help them see that hole a little bit easier and know where to put the syringe. What they'll do is they'll just empty 2 to 3 syringes of that warm salt water in each side. We want them to be rinsing twice a day, usually after lunch and after dinner. And we want them to continue to rinse until those holes have all the way healed up. We only need to rinse the holes on the bottom. The ones on the top, we don't find that food is getting caught up there as much, and they're kind of at a trickier angle, so really it's just the bottom 2 that we need them to be rinsing out. Gravity's kind of working against us there, and we find that food and stuff just kind of gets stuck back there a little easier. So starting after 4 or 5 days, make sure that they're rinsing out those sites on the bottom until the holes are all the way healed up. I have a few more things to go over with you, and then we will get you guys out of here and on your way as soon as we can. One good tip to remember is the more we keep the patient sitting up, the less they're going to swell. Elevation tends to help reduce the amount of swelling that we see, so keep them propped up. If they have a recliner at home that they can crash on or a couple pillows that they can use if they do lay down in bed just to prop their head up, that's gonna help. Try to keep their head above their heart. That's gonna reduce the amount of swelling that you see. Icing will also help. They can do 20 minutes on, 20 minutes off. Sometimes that feels nice, but really the elevation is key to reduce the amount of swelling, so keep them sitting up. If they had wisdom teeth on the bottom that we took out, we're gonna go ahead and place stitches there. They are dissolvable. They should fall out on their own within a couple of days. We usually don't need to see patients back for any kind of a post-op visit unless they are having problems. If you are having problems or questions, concerns, please do not hesitate to contact our office. We will also give you Dr. Burns' cell phone number as well, so you can feel free to reach out to him via phone call or text, even if it's over a weekend or a holiday, or if we're not in office. Please let us know if you're having problems. We want to make sure we're getting things addressed. Starting tomorrow, the patient can also rinse their mouth out with water. Again, we want to make sure we're real careful, we're not spitting real hard or swishing real hard. So if they do start to rinse with water tomorrow, make sure it's just a gentle swishing motion side to side. And when they go to spit the water out in the sink, they're just leaning forward and letting it all fall out. We don't want them to be spitting real hard, again, just because it could cause a dry socket. We also want to make sure that they're still brushing and flossing. They're okay to do that. Just make sure that they're being real gentle, especially as they go more towards the back where the wisdom teeth were. They're probably going to be a little bit more sensitive back there. So still brush teeth, but just be mindful of those areas in the back where the wisdom teeth were, as they will be a little bit more sensitive. We do want to stay away from any kind of mouthwash for at least 3 to 5 days, just because it will tend to agitate things. So stay away from that for at least 3 to 5 days, but you can resume normal brushing and flossing starting tomorrow. Thank you again so much for being here with the person who had their wisdom teeth taken out today. We know that it is time out of your busy schedule, and we appreciate you being here in order to help get them home safely and make sure that they recover well too. As I said, if you have any questions about anything mentioned in this video, please grab one of our staff before you leave. We will help address any questions or concerns, clear up any confusion. Thank you again for coming, and we hope you have a great rest of your day. And thank you for choosing Cache Valley Wisdom Teeth.